Imagine you wake up one morning with a sudden, sharp headache. Or maybe your arm feels weak, your face tingles, or your speech sounds strange. Many people ignore these warning signs, but they can be the first signal of a stroke. Acting fast can be the difference between life and death. What is a stroke? A stroke happens when blood flow to a part of the brain is blocked, or when a blood vessel in the brain bursts. Without oxygen, brain cells begin to die within minutes. That's why doctors call stroke a medical emergency. Stroke is one of the leading causes of disability and death worldwide. But the good news is early recognition saves lives. Warning signs. Now let's talk about the warning signs you should never ignore. A sudden, severe headache with no known cause. Numbness or weakness, especially on one side of the body. Trouble speaking or understanding words. Vision problems in one or both eyes. Dizziness, loss of balance, or difficulty walking. To make it simple, remember the acronym FAST. F. Face drooping. Ask the person to smile. Is one side drooping? A. Arm weakness. Ask them to raise both arms. Does one drift downward? S. Speech difficulty. Is their speech slurred or strange? T. Time to call emergency services. Every second counts. Real-life example. Here's a story. A man in his 50s suddenly felt numbness in his left arm. He thought he had just slept on it wrong. Hours later, he collapsed, and doctors confirmed it was a stroke. If he had gone to the hospital earlier, his chances of recovery would have been much higher. Stories like this happen every day. That's why awareness is so important. Why early detection matters. During a stroke, 2 million brain cells die every minute. The longer you wait, the more damage is done. Quick treatment with medication or surgery can restore blood flow and reduce long-term disability. The faster you act, the better the outcome. Prevention tips. Can we prevent strokes? In many cases, yes. Here's how. Control your blood pressure. Hypertension is the #1 risk factor. Quit smoking. Exercise at least 30 minutes a day. Maintain a healthy weight and diet. Control blood sugar if you have diabetes. Limit alcohol. These lifestyle changes may sound small, but together they make a huge difference. Closing. So next time you or someone near you experiences a sudden headache, numbness, or trouble speaking, don't ignore it. Think fast, act fast, and you could save a life. Stay safe, stay healthy, and remember, knowledge is power.